Hello, welcome to Double9Radio. It's 2022. Yes, it's Candid Expression Sunday with our amazing doctors back in the house. Yes, I'm super excited to have him back here on the show as well. Dr. Segun, welcome back to the show. How are you?
I'm fine, thank you. Well, thank you for welcoming back to the show. And I say hello to all the listeners out there. Thank you.
Amazing. It's always amazing when you're on the show. We always miss you being on the show as well. It's wonderful to be back with you on the show. I'm sure we got something exciting to talk about today, as always. So tell us, what are we talking about today on Candid Expression Sunday?
Tonight, what we're talking about is men and men's health.
Makes a change, doesn't it? Makes a change. Men and men's
makes
health.
A change.
I know. Because we always seem to talk about females, and the females, you know what? We need to talk about men as well. I think we need to probably do a series on men because, men don't get that attention that is required. Men should be getting loads of attention because, men do a lot. And men never share, what they go through or what is actually bothering them as well. So they just, want to have this masculinity displayed all the time. But you know what? They do go through a lot as well. Okay, I'm glad that we're talking about men and men's health today. I think possibly we'll look at the fitness, nutrition, and metabolism because, men's health, it's a huge topic, isn't it? We could be here and have a session and talk. It's a huge session. So I think we'll talk about that. I mean, let's look at what are men's health issues. What are men's health issues? That people or men should be looking out for. What are the most common things from your perspective, Doctor?
For men, mostly, men usually have a lot of health problems. Yes, it's just the biggest problem.
So, Doctor, I think we lost you there for a second. We can't hear you quite well. The volume dropped there. Hope there's no technical issue that's causing this at the moment as well. So, Dr. Jack, can you hear me okay? No, can you hear me?
What about now?
Yes, better. Okay, yeah, sorry, we got Dr. Jack back on the show. Yes, as you were saying, you said men suffer a lot of health issues. It's quite scary when you say that.
Yes, so men can have health issues. It's just how many times do they actually go up to their doctor to have that discussion about what's bothering them? So that's, for me, I think that's the biggest thing with men, to be able to recognize that something is not quite right, and for them to go up to their doctor to at least have a discussion about what it might be, and that can initiate, whether it's that examination that can be crucial, that blood test that might be crucial, that measuring of the blood pressure that might just be crucial, or indeed that visit to the hospital that might just treat something that men would have just thought there was just no need to bother. So the main one for me, it's actually men actually accessing services. Then they would usually get the healthcare that they require. Men can go through a lot of stress, which they internalize, and which society expects men to internalize and not show. So men can have a range of physical health problems, mental health problems, and common on top of most of this list is stuff that might be related to stress. So it's not uncommon to see quite a number of men with high blood pressure, to see men suffering strokes, to see men with diabetes that has been left untreated and untreated really, and not properly managed. And so quite a number of things. And then there could be topical cancers. I say topical because it's in the news, like prostate cancers that would also be things that men don't routinely go up to have checked.
I mean, it's quite amazing you mentioned that about the checks that men don't go for, or and men have this. I as a man as well. I mean, I would concur and agree with that. But I often wonder why we don't do that. Is it because we're scared of what the outcome would be, or we're thinking to ourselves, we're strong, we feel okay, there's no need to go for any checkups. and sometimes it can be quite, not a good thing, not to be too, harsh on that, but it can, because you mentioned quite a number of diseases there. I mean, the most important thing you mentioned was that one of the most serious things you mentioned is prostate cancer. I think they're all serious, about health disease and all of that. But I mean, from your, medical line, profession you see, why do you think men, I want to learn as well today, why do we think we men, have this, reluctance to go and have a health checkup?
I think for me the first thing would be that there is, old time, and I hope we're not still in that sort of time now, where people would say real men don't cry, for example, or men don't cry. We've gone past that, which is very good for society. Unfortunately, there's still some leftover of this of masculine era that we previously were, where men were meant to just suck up that stress. Men were meant to not really show weakness, and being ill, taking time off work could be construed as weakness, as not being up to it. So I suspect that it is a leftover from that causes men to just think, I'm not feeling 100%. I should ring someone, speak to someone about how I'm not. I don't know. I have a fever. I've got sudden joint pains, whatever it is. And I think that is the problem. It's a leftover from that, and so that carries on. So that men actually don't seek the help as easily. If they do go up to seek help rather. It's not unusual that if there is, for example, rest involved in the help they've sought, and as part of their treatment, it's not unusual for men to just brush down under the carpet and just carry on working full pelt, or to modify whatever treatments they are being given. For example, being unable to go on admission, for example, in a hospital for a length of time because of how busy they might be. The hope would be that sort of toxic behavior is slowly receding in society. But it needs education. It needs us educating ourselves, educating men and women alike, so that they are able to get the men in their lives to go towards healthcare, especially when they can notice something not being 100% with them.
Amazing. I couldn't agree with that more. I mean, we just got a message from someone, no name on this one, says that, yes, I agree. My father, passed away from diabetes because he thought everything was fine and he never thought to go for a checkup as well. I mean, look at that example there. And I think that's not an isolated example. It's not an isolated example at all. I think a lot of people, as you mentioned, have this possible mentality of not, seeking that help until it gets to gets very worse, isn't it? Until it gets to a position where, oh my God, what were you waiting for? I think maybe that's one of the things we possibly need to change within the society somehow. I hope that changes. I mean, what are the most common health concerns for men?
I think the commonest ones that people would list is, as I've said, things. It's not unusual that it's related to stress. So you hear things like hypertension, diabetes, mellitus. So that's problems handling your blood sugars. There would be men. Men suffer quite a lot of trauma as well. So it's not unusual that men are in jobs that they have accidents. They can be severely disabled from some of these accidents as well. And then there are cancers that men also can have, ranging from blood cancers through to breast cancer to prostate cancer. And with men and the sort of lifestyles they lead and sometimes their occupation, it's not unusual that you can find lung cancer being another one of those type of top health conditions for them. There will be chronic obstructive airway diseases, like the asthmas, the emphysemas. So quite a number of health conditions that you can find in men. The important thing still is for them to get that diagnosis and for them to be put on a treatment or management program. And most of these conditions I've outlined already are pretty manageable so far we get the right kind of health care to men.
Amazing. I mean, there's something you mentioned, breast cancer. We kind of like, set alarm bells ringing. I'm thinking, so men can have breast cancer as well.
Oh, yes, men can have breast cancer as well, yes. It might not be as commonly reported or as commonly seen as women, but yes, men can have breast cancer as well.
Wow, and this is all, due to age or lifestyle, or is the same kind of factors that women experience as well?
It is not unusual that it will be related to, I would say there will be some people that might have jobs that they work with, radiation, and there'll be people that have family history. But like I said, it's not going to be as common as it would be in women, but it's important for men. So you would find situations where men might have problems in the area of their breast, in the area of their chest, and they would just think nothing of it when they could have that checked. It's by no means like a big common thing that would happen in men, but it's just one of these different conditions that we need to be aware of.
Wow. I mean, that's a new one for me. I mean, you mentioned about checkups and screenings for men.
Yes.
I mean, how often, and at what age should it be done more? Because we have this NHS one that comes, I think, when you're 40. You get a letter sent out to say, you must come have a checkup. Not a lot of people actually pay attention to that. But how important is it to have checkups and screenings, and how often should that be happening?
We're very lucky in this country because as soon as you turn 40, men get their 40-year-old health check. It is a good system to have in place because, like I said, men, especially younger men, they can feel quite invincible, feel indestructible. And just sometimes some men are quite lucky that even coming up to 40, they've not had any significant health care. It might be at that point that someone, does, whether it's their a blood test to check for how they are handling their sugars. Maybe that will be the beginnings of us beginning to find someone that might have diabetes mellitus. It is possible that it's at that stage that you start hearing from men, and they might now start telling you symptoms that might start making you think of, their family history, the risks of them developing certain conditions. For example, as we've talked about it already, prostate cancer, it is in that conversation that they start telling you things like the history that occurred in their uncle, their dad, and the person interviewing you would start putting two and two together. It might be at that health visit that men might, volunteer something about their eyesight. It might be that you check the blood pressure of a man at that stage, and then you now notice how high it is. And high blood pressure can lead on to, when it's uncontrolled, can lead on to strokes. It is even at that condition that men might volunteer how depressed they might have been feeling, mental health conditions. And that's why, for example, in men, it's also a big problem in terms of the mental health side of things, suicides. So it's a very good system. We're really lucky here in the UK. It's a very good system that you reach the age of 40, someone makes a form of contact with you and forces you to focus on your health. And if the system is working really well, we pick up things that men can now focus on to get their health back on track. We would find overweight men by that time. We would find men with, high blood cholesterol levels, and that discussion will be had about your diet, about giving up smoking, about reducing your alcohol intake, all those kind of things. So it's very important, but there are many places in this world that will not have such a system in place where, if for anything, at least the men are captured or caught at the 40-year-old mark, and then they are checked to see whether we can keep on giving them a clean bill of health.
Amazing. I mean, you said quite a lot there, and I really thank you for that. I mean, I think the part where you talked about the person interviewing you, I think sometimes that's the scary part for many men, including myself. Sometimes when you go and you have this discussion, it's like, okay, you feel all right, but someone is not saying to you, oh my gosh, your blood level is quite high, or your BMI is not this, all that kind of plays in your mind. Then you have your family you're thinking about and thinking, oh my gosh, who's going to provide for my family, who's going to do that? But it's more important to have that screen and checkup done, so you know where you stand, isn't it, Doctor? It's very important to have that done, isn't it? Oh.
Yes. So it's really important that you have you go for that screening. So people listening today, you would know that man that whether crossed 40 years old and just thought, there's no need to go to that screening. Encourage them to go. There might be men coming up to age 40 that encourage them to go for their screening when it's time. There will be men listening. When it's your 40s screening, please attend, and just let the healthcare professionals, check your history, do what is necessary in terms of examining you, in terms of checking your weight and height, doing your blood tests, and then just listen to the advice they give you. The aim is to try to get men to start to live longer lives. Whilst there's quite a lot that can cut short men's lives, it's just if you find some of these chronic health problems early, then you can start to manage them really well for a long period to ensure longer lives for men. So things like hypertension, there will be medications for it. There will be follow-up with blood tests as well. Whilst on medications, there will be plans to keep checking your blood pressure. And sometimes once these conditions have been diagnosed, then it is easier for your healthcare professionals to keep in touch with your health going forward. Be it checking your weight, making sure you're not drinking too much, making sure that you're getting enough rests, and on and on. Different things sort of open up in terms of how your health is taken care of by healthcare professionals.
Amazing. You're quite right. I mean, there's another thing you mentioned, which is very common. You hear about it even on the news, even on adverts. Actually, before I keep going on, so if anyone hasn't done the health check at 40 and have missed the appointment that the NHS actually sent over to them, can they still go back and request for that, even if it's after a year or two?
Yes, they can. If they've had their 40s letter and they've, for one reason or the other, missed it, it's not unusual that they get a few reminders. And obviously, because of appointment wastages in the NHS and in GP practices, after a while, they would sort of more or less begging or asking you to come. In such situations, if someone knows they've missed it and they're quite keen to, the first port of call will be for you to ring your GP's practice, speak to them, let them know what your thoughts are about what you're intending to come for. And most of them will be quite accommodating to be able to book you onto whatever next available men's clinic is available in that practice. And I'm pretty sure people will be able to get on quite easily. It is not unusual that they might want to check, like, okay, why do you want to? People might just want to go back now. They haven't listened to the program, but maybe the questioning can also highlight something that might have been bothering the man, and it might be that they tailor that appointment to probably be you go see the GP first instead. Because whatever the men's clinic would have done, the GP can also do themselves.
Okay, fantastic. So, I mean, don't be worried if you've missed your appointment. It doesn't matter how long it's been. It's not, it's not something that you can't reschedule as well. Give your GP a call, as Dr. Segun has mentioned. Okay, the other thing I was trying to mention earlier, just for us, that question was things around, prostate. I mean, a lot of things are talked about in the news. We get this radio jingles as well. We get, adverts on TV. about prostate cancer and prostate itself. I mean, what is prostate? For those who don't know.
So the prostate is a reproductive organ found in men. It's quite a small organ as well. All through medical school, the doctors that might listen to this program, medical students will recognize that we've always described it as the size of a walnut. In terms of underneath where it is located between the penis and the bladder. And where it is located, a tube leads from the bladder through the prostate to come out through the penis, and that tube is the urethra, so it surrounds the urethra, and the main reason is for it to just produce a thick white fluid, which creates the color of when someone ejaculates, or when a man ejaculates, that you see the color of the semen mixed with sperm. In terms of its usefulness, that is why it is useful. The importance of it is there as part of the reproductive organ, but unfortunately it can also get infected. There can be infection in the area. So it can be an infection that can be acute, so that's known as an acute prostatitis, which can manifest itself in pain in the region, someone having to frequently go up to the toilet to pass urine, or in fact difficulty or pain passing urine. It can become chronic, whereby there will be infections that will sort of come and then they'll quieten down, they'll come again, quieten down. And it can be quite involved also in terms of sexually transmitted infections as well, which could lead to either of both or both of what I've just described. And of course, it can just suddenly become enlarged on its own, where you remember I described it surrounding this pipe that leads, or this tube that leads out of the bladder. So if it becomes enlarged, hypertrophied, as we say, it's not a cancer this type, but it now starts to constrict the easy flow of urine from the bladder through the urethra, which is this tube that leads out from the penis. And such men, unfortunately, can have acute urinary retention, and that can be its own world of problems for men, or just difficulty passing urine. And then, of course, the sort of topical one, it's that it can become, it can also, a cancer can develop in the area as well.
Wow.
So that's prostate cancer can develop in the area. Common in men above 50s that have family history of prostate cancer.
Right.
And it's always an important thing that when men start getting certain symptoms, that they visit their GP to have it checked. In terms of the sort of symptoms that men might notice having as regards prostate cancer, that they are finding they are needing to pass water more frequently, especially during the night. They find the need to rush up to the toilet, and when they want to have a wee, it might be difficult for them to sort of start passing water. They might find themselves straining, so they are pushing hard to get the wee out, and the wee might be a weak flow. And then there's always that feeling that one hasn't fully finished passing water. It's unusual to find blood in the urine with this, but that is also a possibility. Now, any one of these symptoms, indeed all of them, does not necessarily mean that one has prostate cancer, but it's enough to ask men to have it checked out when they start getting these symptoms.
Wow. And how is this checked? Is this like sort of a special type of check you have to tell your GP, or it's just like, I need to have a full body check, or you have to mention, this kind of symptoms you're getting?
So always, you see, what the doctors do, the doctors usually are like, they do a little bit of detective work. So they ask you questions, trying to fit it in what's bothering you. And then as they know you already, they know your age. So if you were, for example, above 50, you're from, you were a black man. So it's commoner in black men. So if you had a family history of this, if you were quite overweight or obese, and then if you've been having a diet, for example, that encourages prostate cancer as well, it is possible that your doctor start adding 1 and 2 together. They need to physically examine you, so they would check your urine to just make sure all of these symptoms is not because of a water infection. They'll do a blood test to check for something known as PSA, so it's a prostate-specific antigen. Wow. Annoyingly, as it is called that, it is still not as specific as determining anything for you. When it's really high, we would suspect maybe that there's prostate cancer, but unfortunately, it is not the be-all and end-all of a diagnosis. Then the GP or the doctor would need to examine by inserting a finger into the anus to feel through the anus for the prostate, because that's the only way you can sort of reach in to examine the prostate gland itself. So there they are just checking to see what the consistency of the gland feels like. It is possible it is tender for some people, but that doesn't necessarily mean that that's cancer. It can be tender in infections. They want to get a sense of, is it enlarged, and so on. They get enough information that we now start adding 1 and 2 together. If the levels are quite high, then we have to start thinking of imaging investigations where they are doing MRIs, and there might be consideration to take a biopsy, so to take a tiny piece of tissue from the prostate itself and send off to the lab so that someone can look at it under the microscope to see whether it is anything to worry about.
Wow. I mean, all this sounds very scary, Dr. Shegs. But what can I say? It's something that is necessary. Honestly, I mean, it's oh, wow. You know, man, we do go through quite a lot sometimes. But this is not spoken about in society, and it should be spoken about more to encourage men to go and do this checkups as well. And I think I, for myself as well, need to pay attention more as well. I mean, but are there ways you can actually make your prostate gland strong or resistant to certain, infections or certain ailments?
Well, usually there's a lot of preventive. So men can talk about how can I prevent this from happening. And many different people will talk about, different kinds of things you can do. Sadly, it can be quite difficult with some of these things to carry out rigorous research on them and to have like groups of men. Imagine that experiment where you get a group or 2 groups of men and allow one to have, poor diet or poor exercise patterns and things, and the other one you expose them to all of these good things and then compare them at the end. So people just use evidence from some small studies. And you find people saying, some people would write. So some authors, for example, think men eating good servings of vegetable and fruits, that would help the prostate health. That would help with prostate health. They talk about eating whole grain bread instead of the white bread, and to consider whole grain cereals as well. They talk about limiting the consumption of red meat. So we're talking about beef, pork, lamb,
wow,
goat.
That's not fair. But anyway, carry on.
And they talk about fish and skinless chicken and eggs being healthier for protein intake, especially for men.
Yeah.
They are wondering about their protein intake, having when they do workout regimes. They talk about choosing healthy fats like olive oil, eating nuts, and then to consider reducing fats from dairy products, like your butters and things like that. And then considering reducing or not taking an excessive amount of fast foods, avoiding sugar sweetened drinks as well. So at a certain age, men would have to start reducing consumption of sugar. And cutting down on salt, always good on many fronts, particularly for black men and hypertension. And then they ask men to also watch their portion sizes, because something we know is as you get obese, then you're more likely to start tending towards having problems with the prostate and prostate cancer. They tell men to stay active, so men should endeavor to get into some sort of aerobics program or the other. And it's all of what I've described so far. It feels more like common sense. It seems like a sensible thing for us to undertake for our lives. Not drinking excessively, considering that habit of smoking needs to stop. So these are things that from small studies, but not rigorous scientific studies, to find out all of these answers.
I mean, it's amazing, all you just said. I mean, but the one thing that got me there is, where everyone is having all this barbecue meat and everything, when the summer months are coming right the corner and you have all this meat there, it can be so challenging as well. But I think everything in moderation, as
like
you
I
mentioned.
said, it's to limit. It's to just limit the consumption. It's not, for me, I'm never sort of like halfway about, for example, smoking. Smoking, I would say, look, smoking, it's go to zero. Don't reduce, don't cut down. Stop smoking. End of. You can totally reduce your alcohol intake. You can reduce your consumption of red meat. And quite a number of people, if you were to check, people that, as you said, talk about barbecues, you would find that other than the odd, couple of Fridays, Saturdays, no more than 4 days in total in a month, during the summer months, that's when you see people actually partake in, eating those barbecue meats. But they'll be all through the winter season, and people are at home, and we're all subsisting on our fish dinners, chicken dinners, and not one single red meat is in sight. So, and it's to remember that different cultures eat meat in different ways. Some people, it's like the main meal, while for some people, it's like a garnish to their meal. So it's just to remember that. But just everything you do in moderation. Everything we do in moderation. That's just
everything you do in moderation as well. Don't be back in the day, when we have, our grandfathers and great grandfathers then having to eat, and they want about 6 pieces of beef in the plate to have with the amazing big eba or some Nigerian delicacy there, or some should I say kenke as well for my Ghanaian brothers as well. Okay, I mean that brings us into going into metabolism. I mean does age, does the age of a man, slow down the metabolism? Is there a correlation there?
Yes, there is. I still remember. It's not that far back, really. When I was in my 20s, it felt like I grew up in Nigeria, and it would feel in those times, even periods when I would have malaria, I would just chug down some medication and still go out to school or go out to uni or whatever. You were probably stronger in one's 20s. So it's not unusual that, especially men's metabolic rates would peak when they are in their 20s.
Right.
And once they start hitting 30s, it starts to slow down somewhat. Usually in one's 20s, you see a lot of muscle mass, and then mostly men in their 20s, they engage in quite a lot of physical activity. So, and it in a way, society is structured that way. It's not usual that I start finding that as men start reaching 30 and above, they start getting into more senior posts. They are now getting more office-based. A more sedentary lifestyle starts to set in. And yes, and once you start reaching these ages and a dip in your metabolism, you start finding it's harder to lose weight, really. Metabolism unfortunately slows as we age. Of course, there are different things we can do to augment that.
Yeah, I mean, it's quite funny that you mentioned, increasing of weight and the change of lifestyle and all of that, because I think you're quite right. The older you get, it comes a bit harder to reduce or lose that weight as you consume, all this amazing food around you. And you mentioned that the age, the highest for metabolism is around the 20s, you said, right?
Yes.
Okay.
So around the age, just look at it from like age 20 to 29. Yeah, that would be, especially men, that would be the peak period. I think you would even find that in the world of like sports and things like that, you find some of the men that reach the peak of their careers, they do so in those sort of age ranges, especially when it has to do with muscle mass. It's just more and more these days, technology in research into sports medicine and research into just health and nutrition is helping many men have longer careers, at least the top athletes have longer careers lasting into their 30s. You don't even want us mentioning someone like Tom Brady, who the NFL star, who is in his 40s.
I know.
And is still winning NFL rings.
Amazing.
And if you check some of these people, you see people like Cristiano Ronaldo. They talk about their diet. They talk about how active they still stay, how active they are keeping, just to ensure that this metabolic rate, even if it's slowing down, they're still assisting it to at least work to their favor by keeping fat to a minimum in them.
Amazing.
So they are working off their fat. They are reducing the harms they can introduce by what they might eat, by eating rubbish mainly. And then they keep active, and they watch their health.
Yeah. I mean, metabolism is very important to, anyone's health, again, especially men as well. I mean, but you mentioned it peaks at around the 20s, around there. But is there a way you can increase metabolism after the 20s?
You wouldn't be able to. So I think the way to think of it is, this metabolic rate that we're describing is, there would be a certain age that most people would be at, that even if they were to sit and do very little, they would burn fat. Does that make sense? So whilst as they grow older, if they were to do the same, just sit, then they wouldn't burn as much fat, excuse me, as much fat as they would have a decade before. So, and when you asked about the peak for men, the peak will be in the 20s. So if you had a 24-year-old, for example, that did very little, played a few video games, hardly did much exercises, ate quite a lot of rubbish, in terms of weight gain, it will be less severe than if you had a 34-year-old that did had the same exact same kind of lifestyle.
Yeah.
Does that make sense?
Yeah.
So, in other words, whilst that does not mean that there aren't obese men in their 20s, and the same does not mean that all men become obese in their 30s, 40s, 50s as well. So that's what I mean. It's what you input. So what your intake is, what are you eating, how healthy is your diet. So that is the starting point. Obviously, if you're eating something that your body requires to just maintain its processes, not to lay down too much fat, then already you're not stressing your metabolic rate to work extra hard to try to maintain you at a certain weight. So also, if you're keeping active, so if you don't have a sedentary lifestyle where you're sat around all day, you're putting in some of your exercise routines as well, then yes, you would find that the aim of that metabolic rate, which was to help you keep burning fat, give you energy, then it would still carry on. So it would not be at the same level, but the aim, what it was intending to do, would still be felt. So the effect will still be felt. So as I was comparing athletes, for example, you'll find someone like Cristiano Ronaldo looking almost like some younger men in their 20s in terms of his physique, in terms of his energy levels. And that's most likely because he's putting in that extra work to ensure his diet is tip-top, his exercise routine is tip-top, and he'll probably be getting enough rest as well.
Amazing.
Many of us remember when we were younger, you would sort of party.
I know. You could party from 10 p.m. to 6 a.m. in the morning. You know, you possibly can't do that anymore now.
Take a cup of coffee and then you are good again for the day.
Yeah.
So as you grow older, you'll find that it is important to get that rest in. Otherwise, when you're really tired, you just find yourself eating quite a lot of rubbish, and that's another thing that now causes you to start gaining weight, or you find it difficult to lose weight.
Amazing. I think, I was going to go into the fitness aspect of it as well. I think you've already covered that as well. But the thing there, around fitness as well, men, as you grow older, as you did mention, the metabolic rate does slow down. And you advise, do a bit of workout, go into the gym and all that. But because of sometimes, should I say, what do you call this crisis? I can't remember what it's called now. The word evades me. When you reach a certain, age, and you want to have this type of body, you start taking supplements. It's like, you start taking protein supplements, start taking sometimes people even take
protein shakes and things like that.
Yeah, protein shakes, and they even go a bit further by taking steroids as well, which is something I think it's not good. I mean, yes, workout is being able to do a workout is good, but where does this stop? Because sometimes we heard people go on a really long run. I don't know if this is connected to it. I've read somewhere, I heard on the news, actually heard from a family member of someone who happened to that he's a very active individual. Goes on long runs, could run for about an hour, every day kind of thing.
Yeah.
And eventually the guy actually got to his door and just collapsed and passed away kind of thing. We don't know whether that was a correlation, or maybe there was an underlying issue that caused that. But you never assume that kind of individual could just go like that. Do you know what I mean? Someone that did that workout all the time, watch weight ate, and all of that. So where is the balance?
Yeah, I'm sad to hear about that story you just talked about. It's just, if you just recall, even in the last Euros, you saw what happened with Christian Eriksen.
Yes.
We're talking about athletes, a footballer that will be at the top of their physical sort of state. Especially if they would have had like checkups, they would have had doctors just pour over their sort of health histories through their lives. And that still happened. So unfortunately, these things can happen. If we are able to determine why it is happening, in that particular situation, it was because the heart wasn't beating as fast as it should. And it's a simple thing of just inserting a pacemaker. So it's just a device that notices when your heart isn't beating as fast as it should, and then just does the correction just so that pace picks up. Yeah, that can happen. We've heard of, footballers that have unfortunately passed away on the field while playing. And so it is possible for you to find someone who has kept quite active, runs every day, but unfortunately just succumbs to some unfortunate event, which could be anything like I've described, something to do with the heart. The thing also is there's a lot of people that very quickly subscribe to a bit of self-help. So you're just scrolling through your Facebook, you see some advertisement about how to get so type of body, how to get so type of weight loss. And people start following some of these things. But in the fine print, somewhere at the bottom, they always ask you that before you start doing whether it's the keto diet or is the 3-2-1 diet or whatever, that you should speak to your healthcare professional to make sure that you don't have health conditions that preclude you from being able to undergo such diets or such regimes. Many of us don't take that advice, unfortunately. So you find people go to some sort of extremes. That if they ask their doctor will say, yeah, fine, you can do moderate so and so, but if you want to do it in this particular fashion, then because you're on so and so medications, it is not it's compatible. For example, with this particular thing you're intending to follow. It is also possible that some people just have underlying health conditions, and because they've just, like I said, men are more likely than not they would not want to visit healthcare professionals.
Yeah.
So if they've not visited a healthcare professional to let them know whether it's a high blood pressure that they've not been treating, or whether it's signs that just show that they might be having worsening diabetes, then it is possible for them to just carry on thinking all is well, and then suddenly succumb to a catastrophic event.
I know, which can be quite shocking as well. It is. Okay, I mean, Dr. Shags, it's been amazing all you shared with us this evening as well. I know, there's a lot more around men's health, and we just shared, some light onto it as well. And it's very important for men out there to take care of themselves as well. And also, I think we need to reach out to the partners as well, because the partners can help a lot as well, in encouraging the checkup as well, and also in helping to provide the right diet as well. Do you know what I mean? And encouraging them as well. And also, don't cause depression in their life, because depression can come from different sources as well. Engaging with your partner is very important. I think we possibly need to do a session around men's depression, because it is a big killer in the society as well. Just to touch on a few points that Dr. Shakes have mentioned this morning, this evening on Hill Candid Express this Sunday. Some of the facts he talks about: the major risks to health, to men's health, include heart disease, cancer, depression, and the tendency to engage in risky behavior. Yes, we do that sometimes as well. Men are less likely to visit the doctor than women, resulting in more more hospital visits and deaths as well. They don't want to go to the hospital, but women do want to do that as well. Harmful substances, the natural aging process, are top detriments to men's sexual health as well, because we're now looking for other ways, to, as you mentioned, Facebook, they're telling you, you can lose weight this way, you can lose weight that way, but you don't read the small print to see what harmful that substance can be to you in case you have some underlying issues as well. But I also mentioned regular checkups and health screening can result in longer, healthier lives in most men as well. And most importantly, living a healthy lifestyle can treat most problems associated with men's health as well. All in all, we are here to give you a bit of direction. All the choice is yours as well. As you did mention as well, you can still go for that 40-year checkup if you've missed it. It doesn't matter, 2 years, 1 year. Just call your GP as well. I think I should be doing that, or get ready to do that myself as well. I mean, Dr. Sheggs, what else can we say to men or listen to us this evening?
Yeah, so you summarized everything very nicely, and you captured it well. It's all of what you've just said, and my own general advice is men should just realize that they are day-to-day are not indestructible as we would want to make men realize. And if something's niggling you, be it physical health and especially mental health, please speak to someone. There's always help out there. You would find that as soon as you start taking whatever medications they offer or whatever healthcare advice they offer, you just find it hardly affects your everyday life as you would have feared initially before going to speak to your healthcare professional. But yes, you captured it really well, and we just want men to understand that as much as we can, we'll try to cover a few more topics in the future as well.
Yes, we will, because I think it's quite important we shed a bit of focus on men as well, because yes, women are quite important, but men are very important as well. As you know, men are always trying to put on the masculine front as well, and they hide a lot of things they might be going through as well. Okay, just before we go, I just want to mention some of the foods that can help boost metabolism. Do pardon me this evening. Some of the food that can help boost men's metabolism or your metabolism as well include eating plenty of protein, during the meal. Replacing carbohydrates with more lean protein can help as well. Drinking more water, not overdoing it as well. Some high intensity workouts, breakout workouts, not to be taking some supplements. That's not my, advice. Standing up more if you're sitting out at work, because as we know, most people work from home now. Standing up more does help boost your metabolism as well. And also drinking green tea. I mean, actually, I need to resume drinking green tea. I actually love drinking green tea. And I think it's wonderful if you can get to drink it as well. The proper green tea as well. It is lovely. And eating spicy foods as well. And I know someone might be listening to me and I think, oh, Double9, you don't eat too much spicy food. But I think I need to be trying it a bit more now as well. And last not but the least, last not the least as well, getting a good night's sleep. I mean, we can't stress this as enough. Dr. Shegs has made a point of this as well, getting that rest in between. Giving an example, when you used to go raving and you could go from 9 p.m. to 10 or to 6 p.m. or 10 a.m. the next day as well without getting any sleep. But you know what? You can't do that anymore now. It's all changed because your metabolism has now reduced. It's been amazing to have you on the show, Dr. Shegs. This evening. I can't wait to have you back. It's always fantastic to get your point of view and also educate our listeners as well. Hope you had a great time on the show as well.
Yeah, thank you. I did, and I'll be happy to come back anytime.
Fantastic. I think, you know what, we're going to be talking a bit about men's health as well. Maybe we'll get Dr. Shegs back one more time before the end of this work. We always have him every month, but maybe you can push it and get him back one more show for this month as well, because I think we need to stress more on men's health, because yes, men, we talk about them, they're the householder, but we don't talk about men enough, because we suffer a lot of things and we don't share it as well because of the way society has structured it. But don't be that man who can't reach out and say what's wrong with you. Get that checkup and have that screening done. It's been amazing to have you on the show, Dr. Shegs. And also a big thank you to everyone listening to us this evening. It's been Kind of Expression Sunday here on Double9Radio.